I was told that the drugs were going to fix me. There's an 80% cure rate for leukemia if I did what they were told. Um, but I think by accident, my belief system is really what created a lot of that process and the underlying thing. So I call it the pill for the ill approach to medicine, right? You go to the doctor, he diagnoses you with a thing that they can bill the insurance for, an ICD-10 code. Let's just say it's depression. And then he's been trained, classically trained, like, number one disclaimer of this show is we're not discounting traditional medicine at all. It's got a purpose, but I don't think that's everything. And so this pill for the ill approach to medicine is you have a thing, the doctor tells you what you have, and then he tells you what drug or what pharmaceutical is designed to treat that condition. But in fact, if you really think about that, is does it really treat the condition, the chronic? We're talking chronic, like acute, you get pneumonia, you have an antibiotic, it kills the drug, it kills the bad bacteria, kills some of the good stuff too. We know that now. And then you get over it, right? And so antivirals are in there now and things like that with the pandemic. But like that's acute care. What we're talking about here is chronic care, chronic conditions like blood pressure, depression, anxiety, diabetes, things like that. So you take a drug for a chronic condition, but what does it really do? The mechanism behind it is it really masks the symptom of the disease, not the cause. So it treats some of the downstream effects of what's happening in the system, but we're taught, pharma spends lots of money on this. You see the commercials. We're one of two countries in the world that still can advertise drugs on TV. There's one other country, I forget, it's Finland or it's one of those countries out there, but they're highly regulated. So we're taught and we're marketed to in a really different way that says you have a problem, take a drug, and that drug's going to fix you. But if you really think about it, it's only masking the symptom. It's never getting to the root cause of the problem, which is really where my transition started when as a pharmacist. And we're fast forwarding pharmacy school, getting into pharmacy and really paying attention. I filled thousands upon thousands of prescriptions as a pharmacist, right? I've been in community pharmacy since I was 16 years old. So that's a 30-year journey for me. But what happens is these chronic conditions, you can name any one of them, is they mask the symptom. So there's never really any disease progression that gets better. In fact, if you listen to some of the stuff I've already done and things like that, is in fact, things generally get worse over time. As a pharmacist, I just see more drugs get piled on. And of course, let's say you have blood sugar issues and you're pre-diabetes and the doctor gives you metformin or some blood sugar medicine. He says, all right, you should eat right and exercise and you should take this medication and I'll see you in 6 months, right? So they might do some labs, A1Cs, blood glucose, stuff like that. But what generally happens is we're taught, well, the drug will fix me. So what normally can happen is, did we eat right or exercise? No, we just took the drug. We came back in 6 months. We didn't get where we wanted. The markers weren't great. So the doctor will add another drug. He won't effectively look at lifestyle and the nutrient balance and the foods that we're eating to really affect the chronic condition. That's out of their scope of practice because they don't think they're health coaches or lifestyle coaches or nutritionists. The doctor is generally designed to diagnose the symptom. They're really good at that. Diagnose the symptoms into a condition and then treat it. And generally they're trained. I'm just generalizing here. There's a lot of good doctors, right? I have plenty of friends that are physicians, but generally their scope is, what can I prescribe you? What can I put on a piece of paper that you can bring to the pharmacy? And then that person can take, and then that fixes them. So long of the short is I learned over time through observation that this just wasn't enough for me. It wasn't satisfactory for me. So I started learning and figuring out more of the why. What's really going on here? which led me to all the modalities that I've learned today that we'll go over.